recording, and here is the question. After 1 minute, you'll hear the bell. Right. So if you have read and understood, considering it surgical anatomy station, kindly tell me, what are you looking at?
This is skull.
Okay. Which view?
This is from above.
Yes. So is it just called above, or is there any particular name for the view that you're looking at?
It is cotton skull.
Okay. What are you looking at? What's in front of you? Would you be able to describe it? Right. If it's the skull bone, then there are certain markings that you're looking at, right? What
Yes.
else? There are certain apertures. Yes.
Yes, with foramen, the skull with foramen.
There are certain foraminas as well, because there are more than one foraminas. All
Yes,
right.
foramen.
If you can tell me, if we are looking at the skull bone, then I want you to tell me, how would you divide that? The bone which is in front of you, for the purpose of description.
Anterior,
Yes. Okay.
anterior fossa,
This
medial,
is
and
anterior fossa, right? Quickly tell me
posterior.
the boundaries of the anterior fossa, because this is anterior, but this cannot be whole anterior. So
Yes.
it begins from here till
There's a from isthmoidal bone till the laser wing of
yes,
sphenoid.
yes, yes. That becomes the anterior bone.
Anterior clinoid process
All right. And the this area over here in between these dotted lines, this is which part of the
is the
cranial fossa? Middle cranial fossa. Can you
middle
please tell
cranial
me
fossa.
the boundaries of the middle cranial fossa quickly?
The middle
Anteriorly.
cranial fossa is anteriorly
Yes.
bounded by laser wing of sphenoidal bone,
Very good. Yes. And
and medially
yes.
and anterior clinoid process,
Yes.
posteriorly by
Yes.
vitreous part of temporal bone,
Yes.
and laterally by squamous part of temporal bone.
And laterally, yes. But even in the
Laterally,
posteriorly, there is dorsocella, because this part over here has this number 4. This part has a
clavus,
name. Okay.
clavius.
Right, clavius, yes. But then can you please tell me how many openings there are in middle cranial fossa?
There is 4 foramen,
Okay. Can
foraminal.
you tell me what is or what passes through number 12?
Okay, number 12 is
Yes.
foramen ovale,
Okay. Why does
passing
it
through
called foramen ovale?
because of the shape.
Are you sure it's foramen ovale?
Number 12,
Yes, foramen ovale. Because of the shape. Okay,
yes,
what passes through it?
otic ganglion,
Yes, and
the mandibular branch of trigeminal nerve,
okay, and
and accessory meningeal artery,
yes,
and laser petrosal nerve,
Yes,
and emissionary vein.
very good. Emissionary veins, they pass through it to go where and to form what?
Between what?
They pass through this foramen ovale to where? To form what?
Uh,
To form pterygoid plexus. From pterygoid plexus to cavernous sinus. So they are traversing from here. Okay, good. Now, if we can quickly revise the boundaries of the posterior cranial fossa.
quickly what? Can you ask?
Posterior cranial fossa boundaries.
Posterior cranial fossa boundaries anteriorly by petrous part of temporal bone.
Yes.
And posteriorly by occipital protuberance.
Yes.
And occipital bone.
Yes. And laterally?
And laterally,
temporal, yes, squamous and mastoid part of the temporal bone.
mastoid part.
Yeah, laterally. And superiorly?
Superiorly by tentorium cerebelli.
Yes, very good. And inferiorly?
Inferiorly by foramen magnum.
Yes.
And
so what passes through foramen magnum?
Spinal cord.
Yes. And
spinal artery.
yes.
And root of accessory nerve.
Yes. Anything else?
Vertebral artery.
Yes. More things? Meninges?
Meninges, yes, with the
Yes.
spinal cord.
Yes.
Surrounding.
And anterior posterior spinal arteries as well?
Yes, anterior and
And
posterior
apical
spinal.
ligament of the dens?
Yes, ligamentum of the dens, yes.
And spinal root of accessory nerve? Tectorial membranes? A lot of things.
Membrane.
So this you have to revise and tell me. If you can, by looking at all the apertures here, identify jugular foramen, please. Which foramen is jugular foramen?
Is number 30.
Yes, here. Good. All right. If you can please identify foramen lacerum.
Foramen lacerum is number 10.
10? Where is 10? Should be
On
here.
the left. Number 10.
Okay. All right. Good. Right. What passes through here? Number 5.
Olfactory nerve, olfactory pulp, and
Yes.
And olfactory nerve.
All right. What? All right. Can you tell me? Okay. All right. Can you tell me where would you find the impression of middle meningeal artery? Can you see on this this set of bones, anterior, middle, or cranial, the posterior cranial fossa, which you are in front of you?
Middle meningeal artery.
Yes, the impression of it.
I cannot see.
Okay, no, it's not here. Okay, can you tell me what is clavis?
Clavius is
Yes.
number 4.
Yes, what is it?
It passes through it abducens nerve, so that I know.
Okay, but how would you define clavis?
It is the flat area of the skull.
Okay.
And passes through it abducens nerve.
Okay, good.
Or cross
Right.
it.
What more I can ask you with reference to? All right, this is it. This is good. You know your apertures and you know your foraminas, and Bella is also gone. Good. Thank you.
Okay.